All right, today we're breaking down Hodgkin's lymphoma. Now, it's a type of cancer, sure, but it has some really unique features that set it apart. Using information directly from leading medical texts, we're going to get into exactly what it is, who it affects, and maybe most importantly, why there's so much hope for a cure.
We're going to follow the logical path here, almost like a patient's journey. We'll start with the unique cellular signature of the disease. Then we'll look at who it typically affects, how doctors figure out what's going on, the modern ways to treat it, and finally, the incredibly positive outlook for most people.
So, what makes Hodgkin's lymphoma? I mean, what makes it different from all the other lymphomas out there? Well, it really all comes down to one thing, a very specific signature cell that pathologists are looking for under the microscope.
And this is it. This is the Reed-Sternberg cell. It's basically a large, cancerous version of a normal immune cell we all have, called a B cell. Finding this during a biopsy is the definitive proof. It's the smoking gun. If you find this cell, you've found Hodgkin's lymphoma. Okay, so we know what it is on a cellular level, but let's zoom out and look at the bigger picture. Who is most likely to get this diagnosis? The data here shows some really distinct and kind of surprising patterns.
Now, what's great is we can look directly at the epidemiological data from the source. A couple of key things jump out. The incidence is pretty low, about 4 new cases per 100,000 people a year, and it affects slightly more men than women. But the most striking pattern by far is all about age.
The median age at diagnosis is just 31. Think about that for a second. That is incredibly young for a cancer diagnosis. It means this disease often hits people right when they're starting their careers, their families, their adult lives. And this chart illustrates that perfectly. It's what's called a bimodal age distribution, which is pretty unusual. You see this huge peak in diagnoses in young adults from about 20 to 35, and then another, smaller peak way later in life, between 50 and 70.
And it's not just about age. The disease itself actually has different forms. This table shows us the official classifications. You see, Hodgkin's isn't just one single thing. It has several subtypes, and each one is defined by how the cells look and are arranged.
And this breaks it down even further. For the most common form, which is called classical Hodgkin's lymphoma, you can see that one subtype, nodular sclerosing, accounts for a massive 70% of all cases. And get this is the exact type most often found in those young patients we were just talking about. So we know what it is and who gets it. But how would you even know you might have it? Let's talk about the common signs and symptoms that usually lead someone to see a doctor in the first place. The absolute classic sign, and the most common one, is a painless but swollen lymph node. It's often in the neck or just above the collarbone, and people say it feels kind of rubbery. Another key feature is that Hodgkin's tends to spread in a very orderly, predictable way, moving right from one lymph node group to the next one over. Now, besides the swollen nodes, doctors are always on the lookout for a specific trio of symptoms that affect the whole body. They're called B symptoms, and they include drenching night sweats, fevers that come and go for no reason, and losing a significant amount of weight. Having these symptoms is a really important clue for doctors when they're staging the disease.
So the path to getting a diagnosis is a multi-step process. It usually starts with blood tests to look for general signs of inflammation. Then, doctors use powerful imaging like CT and PET-CT scans to get a map of exactly where the disease is in the body. But the final, definitive step, the one that gives the answer, is that lymph node biopsy to actually find those Reed-Sternberg cells.
And that diagnosis leads us straight to treatment. And honestly, this is where the story of Hodgkin's lymphoma becomes one of modern medicine's biggest success stories. The focus is crystal clear. Cure the disease, but do it with the least amount of long-term harm possible. The game plan for treatment really depends on the stage of the disease. It's pretty straightforward. For early-stage cases, the standard is usually a short course of chemotherapy, followed by highly targeted radiation. But for more advanced disease, doctors typically use a longer course of chemotherapy all by itself. This quote just nails the entire philosophy. It's a delicate balancing act. Because so many patients are young and have such a high chance of being cured, the goal isn't just to beat the cancer now, but to make sure the treatment doesn't cause serious health problems decades down the road. And this is a real game changer. Doctors can now use these PET-CT scans partway through treatment to see exactly how well it's working. If the cancer's melting away, they can often de-escalate the therapy, maybe skip radiation or a particularly toxic drug, all to protect the patient's long-term health without sacrificing the chance for a cure. It's brilliant. So finally, let's talk about the prognosis. After the diagnosis, the staging, the treatment, what's the outcome? Well, for most people with Hodgkin's lymphoma, the outlook is incredibly good.
Just look at that number, over 90%. For patients who are diagnosed with early-stage disease, the cure rate is over 90%. That makes Hodgkin's lymphoma one of the most curable cancers that we know of. It's a phenomenal achievement.
And that hope is not just for early-stage cases. Even for patients with more advanced disease, thanks to those smarter, PET-guided therapies we just talked about, long-term survival rates are now climbing past 80% and still going up.
And the science is not standing still, not by a long shot. For the small number of patients who relapse, powerful treatments like stem cell transplants and amazing new immunotherapies called checkpoint inhibitors are changing the game. These new drugs basically take the brakes off the body's own immune system so it can hunt down and kill the cancer cells. The goal is always the same: smarter, better, safer.
And that really brings us to the central question that's driving all the research today. The challenge isn't just about curing the disease anymore. It's about ensuring that every single survivor goes on to live a long, full, and healthy life, totally free from the late effects of the very treatment that saved them. That's the next frontier.